Was geht up? Someone asked me between Krankenhaus and Heim. If I get a contract from Germany between Krankenhaus and a Heim, which one should I sign? My friend, if there are factors to determine where you're going from Kenya, where you're going to in Germany. So if you're going to a city, make sure it's affordable. The city is affordable. The houses are a little bit cheaper. Yeah, cost of living is cheaper because in Germany, every city has their own rules. Like it's like this thing that government wanted to pass, like not majimbo or some majimbo in Swahili. So every town has their own living standard. Like you may find a house in Stuttgart is like 1,000 euro, but when you go to Dortmund, it's like 700 euro. Yeah, so it depends. But for me, I'll choose Heim because Heim is a little bit easier to maneuver. Like you can work well with your workmates and your boss. Just your boss and your workmates. Full stop. Heim is good because like you have 3 shifts. I come in the morning, afternoon, or night shift. So the only time you are with your boss like face to face is when you are signing the contract. After there, the only time you'll be face to face with your boss, remix with your boss, it's when we have like a staff meeting or dazo. But so it's only you and your colleague. Like when I come in at 2 p.m, there's something called Ubagabe. Ubagabe just like to tell you, friend who's coming in like today, it was like this and this. There's nothing much going on, blah blah blah. Full stop. You go change your clothes and go home. You wait for the next day. Understood? Now, working in Krankenhaus. Krankenhaus is a hospital. My friend, hospital has a lot of challenges. Hospital, you'll be tired 24/7. In hospital, you'll be running up and down the corridors. Every now and then, you are up and down, running here and there. Another thing, you'll give Ubagabe, and when you are on duty, you have to work together with your with a doctor. Like when you're going to room after room, my friend, working with a German doctor, just walking and talking, walking, not working. When you're just walking with your doctor from one station to another, my friend, you'll suffer because they are talking with their accent. You don't understand their accent, the Dutch accent. You want this, you don't know the name clearly, and then you are alone. If you are like 2 nurses and the doctor, if you don't understand, the nurse will understand. But here, my friend, you are alone. You go from one room to another, like maybe accident, emergency, maybe people are going to die. You know, in hospital, we are different departments, mad people, a lot of stuff going on, ICU. So maybe you're working with your doctor, he asks you this, you don't know. When he asks you something and you don't know, you'll be like, are you really supposed to work here? And then he'll go to the boss and say this and this. Yeah, you know Germans talk, they talk a lot. Your doctor will go to your boss and say you are very incompetent. You cannot work in a hospital because you don't understand the language. You don't understand the simple instruction given to you, like give me this, give me that, give me that. Can you please give this patient this? Because they'll say, if you don't understand simple instruction, they can't trust you with their patients. Maybe you can overdose them, or maybe you give the wrong medication. So it's always good to work in a place where it's quiet. You are only you working. Yeah, like night shift. Night shift, there's no boss. In a Heim, not in a hospital. In a hospital, there is boss. In a Heim, I'm rotating so that you can see my face, but it's too sunny. In a Heim, like on a night shift, you will come at 8 p.m. The only person on the shift is your colleague. When you come in, your colleague will say that today was this and this and this and this and this. Now I'm going home. You, guten Nacht, continue with work. Full stop. Now, Heim, it has disadvantages because there are some patients that they can't use toilets by themselves. So you have to help them. By helping them, it means you take him from her or him from the bed, you take them to the toilet, you stand there, they finish caca, you wipe them, you turn them to the bed. If they pee-pee is pee-pee, they urinate on beds, you have to clean it. If they're using Pampers, because they are very old, it depends with the home. You have to clean the bed, give them Pampers, go make medicine, medicament, not make, but you put them in order. Like Rogers, he needs to have like this medicine and this one for pain, for this, for diarrhea. Victor has to have this. So you arrange the medicine according to doctor's prescription, like that. After that, you relax a little bit. Again, you go another round. Like let's say you came to job at 8. You went the first round, checking everyone if they're in correct order. Now you come make your medicine. I'm translating from Dutch to English. Make. You make the medicine. After that, you relax a little bit, and then you go another round. Let's say at 12 a.m. you check again. And also, at time you will not be sitting down because there are bells. Like someone will be sleeping on the left side. Now he has to ring the bell, and then you go change him to right side. You understood? So Heim is good. Others, they cannot sleep because they need medicine to sleep. They'll be awake all night. At 4 a.m. they'll be ringing the bell. And in Heim, we have like bell from, like a patient can ring when he's in his room. Like you just ring the bell. When you're in the station, you go check, blah blah blah. So you'll be checking, you'll be going round and round. But it's a nice job because you are just alone with your fellow colleague at night and your patients. There's no doctor. But in case of emergency, you have to call the doctor. Where we have doctors 24/7. Like when the patient's like falls down from the bed to the floor, he hurt himself, you have to call the doctor and write in the book like everything. You have to document everything. If a patient falls down, you write. If a patient bleeds, you write. You have to write in the computer. And then if it's an emergency, you call the doctor, they come, they check. Now, you are just chilling, you and your colleague and your patients, yeah? So working in a Heim is good. And then again, now, the cities you want to go. Just Google about Stuttgart, Dortmund, Essen, Dusseldorf, and then you'll get the clear picture of how the cost of living is, yeah? Because in Stuttgart, it's very expensive. Dortmund is a little bit lower, yeah? So come to Germany, yeah? And work in a Heim. I'll see you next one. Bye-bye.